Have you ever found yourself in the shower, or perhaps in the moments immediately following intimacy, looking down and noticing that things just aren't the same as they used to be? Maybe the quantity seems to have significantly reduced over the last few years. Or perhaps it's the force behind it, the shooting distance, that feels much weaker than it did in your 20s. It is a moment of quiet realization that can actually be quite troubling for a lot of men. You might wonder if something is broken, if your fertility is tanking, or if this is just the beginning of the end of your vitality. It is a very common insecurity, yet it is one that men rarely discuss openly. Because of this silence, many turn to the internet, where they are bombarded with ads for miracle pills and questionable supplements that promise to triple your volume overnight. We need to be clear right from the start. Most of that is absolute marketing garbage. Today, we are going to bypass the hype and look at the actual physiology. We are going to discuss what is biologically happening inside your body that causes this volume reduction, and then we will walk through 5 specific natural habits, lifestyle changes, and mechanical adjustments that can genuinely help you optimize your seminal volume without relying on magic tricks. Before we try to fix the problem, we have to establish a realistic baseline. A lot of the anxiety men feel about this topic comes from unrealistic expectations set by the adult film industry. In the real world, biology has limits. The average healthy man expels between 2 to 5 milliliters of fluid per ejaculation. To visualize that, 5 milliliters is roughly a teaspoon. If you are consistently in that range, you are actually medically normal. It is also crucial to understand that this fluid isn't just coming from one place. It is a cocktail. While the testicles produce the sperm, they actually contribute very little to the total volume of the liquid. The bulk of that fluid, the plasma, is produced by the seminal vesicles and the prostate gland, with a little help from the bulbourethral glands. It is a complex factory line. If any part of that assembly line is sluggish or inflamed, the total output drops. So, when we talk about increasing volume, we are really talking about optimizing the health of these specific organs. So, why does the volume drop? Before we get to the solutions, you have to identify if you are sabotaging yourself with one of the 4 main culprits. The first culprit is hormonal, specifically testosterone. This hormone drives the entire male reproductive system. If you are suffering from hypogonadism, which is the medical term for low testosterone, your body simply doesn't receive the signal to produce seminal fluid at full capacity. The second culprit involves your medical history. If you have had surgeries in the pelvic region, particularly prostate surgeries or procedures to treat an enlarged prostate, these can physically alter the anatomy and the plumbing, leading to permanently reduced volume. The third culprit is medication, and this is a big one that many men don't realize. Certain drugs, specifically alpha blockers like doxazosin or tamsulosin, are often prescribed to help men pee better if they have a tight prostate. These drugs work by relaxing the muscles in the bladder neck. However, there is a side effect known as retrograde ejaculation. Under normal circumstances, when you ejaculate, the neck of your bladder closes tight so the fluid has only one way to go, out. But if you are on these medications, that bladder neck stays relaxed and open. Instead of shooting out, the semen takes the path of least resistance and goes backward into the bladder. You still feel the orgasm, you still get the sensation, but little to nothing comes out. This is often called a dry orgasm. It ends up coming out later when you urinate. The fourth culprit is lifestyle. This is the category we have the most control over. Chronic alcohol consumption, smoking, obesity, and a sedentary routine are disasters for reproductive health. They increase inflammation, disrupt hormone production, and restrict blood flow. And, of course, there is the natural factor of aging. As we get older, just as our muscles get a bit weaker and our skin loses elasticity, the glandular tissue in the prostate and vesicles produces less fluid. That is a natural part of life. However, even with aging, you can maximize what you have. Let's look at the 5 evidence-based ways to naturally increase volume. The first habit is the simplest, but also the most neglected: strategic hydration. Semen is biologically mostly water. If your body is in a state of systemic dehydration, It will prioritize keeping your vital organs functioning over producing reproductive fluid. Your body is smart. It will conserve water where it can, and seminal volume is one of the first things to get cut. If you are dehydrated, your semen will be low in volume, thick, and gelatinous. To fix this, you need to look at the math. A general rule of thumb for optimal hydration is to drink between 30 to 50 milliliters of water per kilogram of body weight. So, if you weigh 80 kilograms, you should be aiming for roughly 2.5 to 3 liters of water every single day. If you start hitting this target consistently, you will often notice a change in viscosity and volume within a few days. The second habit is targeted nutrition. This is where people get scammed by volume pills, but the underlying science is real if you strip away the marketing. Your prostate and seminal vesicles require specific micronutrients to function. If you are deficient in these building blocks, production stalls. The key players here are zinc, selenium, vitamin E, and an amino acid called arginine. These are essential for the synthesis of seminal fluid. However, there is a massive caveat here. Supplementation really only works if you have a deficiency. If you already have a balanced diet and your levels are normal, taking a megadose of zinc or vitamin E won't turn you into a fire hose. Your body will simply filter out the excess and excrete it in your urine, or worse, you could put unnecessary strain on your kidneys. You cannot supercharge the system beyond its biological limit, but you can ensure it has the raw materials it needs to not run empty. Focus on foods rich in these nutrients, nuts, seeds, lean meats, or consider a sensible multivitamin if your diet is poor. Now, speaking of nutrition and blood flow, there is one specific, all-natural method that is getting a lot of attention for how it targets the root vascular causes of these issues. It's not a pill, but a bizarrely simple purple tonic. You can make it home in just 7 seconds. Unlike dangerous medications that just mask the problem, this remedy focuses on clearing out the biological blockages that kill your flow and firmness. If you want to see exactly how this 7-second ritual works to restore rock-hard vitality, scan the QR code popping up on your screen right now. I've also pinned a link to a short video explaining this natural fix at the top of the comments below. It's worth watching if you feel like you need an extra push beyond just diet alone. Moving on to the mechanics of the tank. The third strategy is managing the frequency factor. Think of your seminal vesicles as storage tanks. They are constantly producing fluid, but that production takes time. If you are evacuating the tanks every single day, or multiple times a day, the body never has enough time to fill them to maximum capacity. The volume will naturally be lower. For couples who are trying to conceive, or for men who simply want to experience a higher volume event, the recommendation is usually an abstinence period of roughly 2 to 7 days. This allows the seminal vesicles to fill completely. However, there is a point of diminishing returns. Waiting longer than a week doesn't necessarily mean more volume, and it can actually lead to lower quality sperm as they begin to die off. But if your goal is strictly volume, spacing out your ejaculations is the most immediate way to see a difference. The fourth tip is purely mechanical. Strengthen your pelvic floor. Ejaculation isn't just a passive flow. It is a forceful expulsion driven by muscle contractions. The specific muscles involved, particularly the bulbospongiosus muscle, are part of your pelvic floor. If these muscles are weak or atrophied, the expulsion force will be weak, and the fluid might just dribble out rather than shoot, which creates the perception of lower volume. You can train these muscles just like you train your biceps. This is done through Kegel exercises. The easiest way to identify these muscles is to stop your stream of urine mid-flow when you are in the bathroom. The muscle you clench to cut off that flow is the pelvic floor muscle. To train it, you practice clenching that muscle when you aren't urinating. Hold the tension for a few seconds, then relax. Doing sets of these contractions daily helps strengthen the pump mechanism. A stronger pump means a more forceful release, which optimizes how the fluid is expelled from the urethra. The fifth and final step is an audit of your medications and habits. You need to take a hard look at what you are putting into your body. As we mentioned, if you are taking medication for an enlarged prostate or even certain hair loss medications like finasteride or dutasteride, these can have a direct impact on semen volume and thickness. If this is causing you distress or affecting your quality of life, Do not just stop taking the medication. That can be dangerous. Instead, schedule an appointment with your doctor. Explain that this side effect is bothering you. There may be alternative treatments or different dosages that can preserve the therapeutic benefit while reducing the side effect. Simultaneously, you have to be honest about your vices. Alcohol is a testicular toxin. It lowers testosterone and increases estrogen. Cigarettes damage the blood vessels that are crucial for both erections and the function of the prostate. If you are overweight, the excess fat tissue also converts your testosterone into estrogen, further suppressing your reproductive drive. Losing weight, quitting smoking, and moderating alcohol are perhaps the most powerful supplements you can take. In conclusion, there is no secret switch or magic potion that will permanently alter your biology beyond its natural limits. But the reality is that most men are operating below their potential due to dehydration, nutrient gaps, poor lifestyle choices, or medication side effects. By addressing these 5 areas, hydration, nutrition, frequency, muscular strength, and lifestyle habits, you can maximize what your body is capable of producing. It is not just about the volume. It is about what that volume represents. A healthy reproductive system is usually a sign of a healthy body. If you focus on getting healthy first, the rest often follows.